Have you ever experienced or witnessed this? Well, if you notice, it tends to be regular and rhythmic. In this video, I'll be discussing hiccups in adults and babies and its management. At the end of this video, I'll be giving tips on home remedy for the management of hiccups. Let's dive right into it. What are hiccups? Well, hiccups are sudden involuntary spasming of the diaphragm that results in a hic sound. The diaphragm is the muscle that separates the chest from the abdomen, and its primary role is in respiration or breathing. So when the diaphragm goes into spasm, it suddenly impinges on the lungs, and there's a sudden gush of air from the lungs, resulting in a hic sound called hiccups. The good news is this: most hiccups are of minor medical problems. However, hiccups lasting greater than 48 hours may be a signal of a major medical problem. What are the causes of hiccups? Well, for hiccups that last less than 48 hours, the triggers are most often time eating very fast, swallowing air as during chewing of gums, drinking carbonated drinks, drinking of alcohol, and etc. However, for hiccups lasting greater than 48 hours, the trigger is usually as a result of irritation of the nerves that supply the diaphragm, vis-a-vis the vagus nerve and the phrenic nerve. Typical examples of causes are 1. Pneumonia, brain tumor, encephalitis, stroke, meningitis, tumor in the neck, liver abscess, chronic liver diseases, some electrolyte imbalances, metabolic disease like diabetes mellitus, etc. In babies, the causes include overfeeding, swallowing of air, eating very fast. Most hiccups in babies will resolve within 48 hours, and in most babies, it's of minor, insignificant medical importance, and it will resolve spontaneously. Now, what are the symptoms of hiccups? Of course, they present with a typical hic sound that is repetitive and tends to be rhythmic. There may be history of chest pain, cough, fever, occasionally difficulty in breathing, depending on the underlying causes. How is it diagnosed? By taking simple history, in which you will get a typical hic sound that is repetitive. Your medical professional may ask for some investigation to know the causes. How is it diagnosed? A good history, examination by a medical professional, and of course, occasionally, you may ask for some investigation to know the underlying causes. How is it managed? Management. Well, for hiccups that last less than 48 hours, usually resolve spontaneously and may not need any medication. However, hiccups lasting greater than 48 hours may need medication. Common medication used include baclofen, chlorpromazine, etc. In babies, usually the management is simple, either by feeding the baby slowly, rubbing the back of the baby with the abdomen on your shoulder to expel excess air. Now, what are the home remedies? Home remedies for hiccups. Well, this tends to be simple, especially for hiccups that last less than 48 hours. One of the remedies include 1. Sipping of cold water, gargling of warm water, drinking water from the other side of the cup, Well, I will demonstrate it in the next video. Biting on lemon, distractional therapy, as on hiccups tends to disappear when you distract the patient with something scary. You know, the patient will tend to forget it and the hiccups will go. We tend to forget the hiccups and it will go. Please, if you have any question at the end of the video, you can ask in the comment section and you'll be assured. And be assured that your question will be answered. Thank you.